The vision for Durham Regional Hospital and the staff here at Durham Regional Hospital is to be the best community hospital in North Carolina. One of the things that has happened that begins to reaffirm what we're doing is over the course of the last year, we've implemented a number of different changes that is aimed at addressing and providing the best possible care to our patients in a culturally competent way. The result of that is we are beginning to receive many letters that tell us how we are providing care, and those letters come to me regularly. And think about this in terms of it's much easier to write a negative letter and much more difficult to take the time to write a letter that says, I am happy and satisfied, and I want you to know what you have done for me and my family. And so those are the type of letters that I think reaffirm that we're doing things the right way. I'd like to share a letter from one of our patients and his wife with you. And the letter is addressed to me, and it begins, letter of appreciation. It says, my wife Connie and I would like to thank you and the members of Durham Regional Hospital for the fantastic care provided me during my recent surgical visit.
A year ago, I was diagnosed with prostate cancer and scheduled for surgery. There was some apprehension when we were first going in. We'd been here for, I guess, 32 years and had not had to use a hospital, which was very nice. And then last June we had to for my surgery, and then this Easter we did it again for Connie, had a emergency appendectomy, and we went into the Durham Regional. Both experiences were very wonderful.
My pre-processing prior to the day of surgery was friendly, efficient, and allowed us to focus completely on the surgical procedures on the actual day.
The next day we went in, other than starting early in the morning, again we were welcomed in, the prep team was there, put me completely at ease again. During the surgery, of course I don't remember much about what was going on, but the nurse went out every hour to let Connie know that everything was going fine. And I say they came in every hour, and an hour is 60 minutes unless you have someone in surgery, and then it's a long time. And your mind has the tendency to think the worst things going on. So it kept Connie at ease for the whole time. And I had the same experience this Easter. Connie went in for an emergency appendectomy. And it was only about 2 hours, but it was a long time for me this time, sitting out worried about her and thinking all the things that could be wrong. And of course, the same thing, someone came out and reassured me, and it made all the difference in the world.
Approach every patient and see that patient as your loved one, as your child, as your mother, as your husband, as your brother, and think about how you would expect and what you would demand in terms of care for your loved one.
Then I came to in my room up on the 6th floor, and from then on, everything just went very smoothly. As I recall, engineering came in to make sure everything was working fine. The cleaning staff made sure the room was very good, and the meals were very good. Hospital food was wonderful. I enjoyed that. And all the way up through till discharge. PT came in and made sure I could walk up and down the steps, and walked up and down the hall and did everything. It was just a very nice experience. The questions that we asked were very well answered and put us at ease. The questions we didn't know enough to ask were answered, and again put us completely at ease. So both Connie and I were very comfortable going in. Apprehensive, sure, but comfortable that the care we would be given would be first rate and that everything would be fine. The idea that he went over it so completely with us and made sure we understood what the decision was and let us make the decision, although he helped us with it. So the day of discharge, the nurse came in and told us what would happen and how to handle things, and both Connie and I felt very comfortable then about going home and being able to take care of things. I guess the other thing, it wasn't part of discharge, but it happened the last day, happened to be my birthday. And 3 of the candy stripers, or as you pointed out, are junior volunteers now, came in and sang happy birthday and gave me a little cuddly bear, which was very nice. I would recommend Durham Regional, and I wouldn't do it lightly. That's something that you want to be very careful of, because it's your life you're dealing with, and not that ours was life-threatening, but it's still something very personal, very nervous about people, and I would certainly recommend them, and They give you the care that you need, and they put you at ease. And that's very, very important.
Every person I met, as I shuffled along the halls, met me with a smile and words of encouragement. Those are satisfied people, not just doing a job, but doing what they love
and being very good at it. Please convey our heartfelt thanks to everyone for their effort and care. They and Durham Regional Hospital provide us with yet another good reason to be proud of Durham and its many accomplishments. Sincerely, Bill and Connie Medlin. My wife, Connie, and I both signed this letter, and we meant every word of it.